Hey there, everyone. My name is Nasser Hawthorne. I'm a physiotherapist, and I'm just gonna be today just starting a video journal of my experience with my own injury, which is this time a left Achilles tendon rupture. I suffered this injury on the 9th of December, so just about 6 weeks ago, and I'm gonna just do this video first of all just to let you know what's happened in these first 6 weeks, and then I'm going to hopefully do some more videos afterwards to let you know just how things are going and my progress, especially when I start rehab, just to let you know what kind of exercises and things I'm going to start doing and when that happens. Okay, so obviously 6 weeks has gone past, so there's a lot to cram into this 6 weeks, so this video might be a little bit long, but just bear with it and just see how my experience was. Okay, obviously if you're watching this video, you may have had your own Achilles tendon injury and just want to know how things are and how other people deal with it. I know there are a lot of videos out there on YouTube about different people's protocols and the different way they recovered through from the injury and different treatments they had. So this is just my experience of it. Okay. Normally, as I said, I'm a physiotherapist myself, so normally I'm on the other side of these type of injuries. Normally treating people with them, helping them with their rehab, doing the exercise programs and everything for them, and obviously following the protocols set by the surgeons or the doctors. This time I find myself on this side of it as a patient myself and going through the injury, so it's just good to see, well, not good, but it's interesting just to see it from this side of things. So yeah, as I said, my injury was the 9th of December, so it's about 6 weeks ago. I had a kind of a standard mechanism of injury in terms of this type of injury. I am what they'll call is as a weekend warrior, which is what they kind of say, people who get these injuries generally are, which just means that you play sports, but you play it maybe at a weekend or just casually or something like that. Every now and again you think you can come up and play sports like a sportsman, and you tend to get these little injuries, especially when you're deconditioned. And for me, I was a little bit deconditioned at the time. I do like playing football, but I had not played for kind of a couple of months before in 2019. But when this injury I was starting to get back into it when it happened. I maybe played back 3 times in the month leading up to the injury. This time I went to play some five-side football with some friends one evening, and literally the ball was just there. It was like loose on the wing. Nobody was around me. I just went to kind of push off the sprint for the ball. Again, no one around me. Just felt that, and with my left leg planted behind me to push off, I felt a snap, heard the pop in the back of my left calf, and just fell to the floor. And I couldn't weight bear on the leg, couldn't move it, and it just was in a lot of pain. Everyone around me was kind of saying, "Oh, maybe it's a strain, maybe you sprained your ankle." Being a physio, knowing the kind of mechanism of injury of this type of thing, I kind of knew what it was. I heard the pop, felt the snap, and I couldn't weight bear, which is a classic sign of an Achilles tendon injury. So we went straight to A&E, and was seen at A&E. They did an x-ray just to make sure there's no fracture or dislocation for the ankle or anything like that, and then saw the nurse. So basically with the Achilles tendon, it's a very strong thick tendon in the body. It connects your calf muscle to your heel bone in the back of your leg, and it's responsible for kind of the push off when you're running, when you're jumping, that kind of power that your body generates. So it's a very powerful tendon to connect to the calf muscle to kind of generate those forces, and it is one that's commonly injured because of that. So with this injury, the calf muscle, it is responsible for kind of pointing the toe forwards. So when you point your toes or kind of go on your tiptoes, it does that movement. So when they test for it, and when I went in, what they did, they kind of put you in a relaxed position, either kneeling on a chair or lying face down. And what they do is they kind of, would you relax, they kind of squeeze your calf muscle. And when you squeeze your calf muscle, your toe should point downwards slightly. If you've got a rupture, as I did and was found to have, nothing happens basically. So they squeeze the calf and there's no movement on that side, and they can compare it with the good side, of course. So they are tested positive for the Achilles tendon rupture. Yeah. So this is as I said, it's a common injury, per se, more common nowadays, where people are trying to get more active and trying to stay healthy as they get older as well, because it's an injury that mainly affects people maybe aged 30 to 50 roughly, who are still trying to keep active, but obviously juggling it with their life, and so make a lot of the time not regularly active. So I was just creeping into that age group, and this happens to me. So now, but obviously it does happen to sports people as well, and it can be quite a detrimental injury to have for a sports person. And most notably, recently we had the footballer Callum Hudson-Odoi, who plays for Chelsea. He had a quite good recovery from it. He was young, only 19-year-old guy. Injured in April 2019. He was back playing football in the Premiership by September 2019. He had surgery to fix it, so he recovered quite quickly. We'll go into a bit about surgery and the treatments and stuff for it afterwards. But in the past, you might have known of obviously David Beckham. He suffered it while playing for AC Milan. There's also NBA players. Kobe Bryant suffered it. DeMarcus Cousins suffered it. Kevin Durant as well. And most recently, if anybody's into boxing, you might have recently seen the boxing fight between Gervonta Davis and I think Gamora, I think his name was, a Cuban boxer. And the Cuban boxer, he suffered Achilles rupture, I think something like in the second round, and somehow he warrior through it. He was able to stay fighting for do the full 10, do like 10 rounds, I think. Afterwards, do 10 more rounds after. So, and then afterwards he came out and said he had Achilles tendon rupture. So, not like me rolling around on the floor, he was able to keep fighting. So yeah, and obviously in the past, David Hay, when he fought Tony Bellew, he did a similar thing and kept fighting for it, and then found to have a tendon rupture as well. So, wow. But anyway, so back to me. So I had, as I said, I had the injury, went to the A&E, and they put me in what they did after they said, okay, it must be Achilles tendon rupture. They put me in a below knee back slab, so a temporary cast at the time, but they put me in what they call the equinus position, so with the toes fully pointed downwards in the back slab, just to, because that's the position they want the tendon to heal in. They want to heal nice and tight in that position, to bring the ends close together, because at this point you don't know kind of how far they're apart or what's going on. So they put it in that position and to heal, and they said they put me into ultrasound, and I'll see the consultant at some point. Unfortunately for me, again, the fact that I'm on this side of things, normally being a physio, this was a frustrating time dealing with the NHS. The care after this point was very poor. Obviously on the day at A&E, I didn't see a doctor. I only saw a nurse who did that, and it was me chasing them up for the ultrasound scan to see the consultant. Complications afterwards. It was just stressful time, especially when you're dealing with injury like this that is so disabling, and having to then deal with the chasing up while nothing happens. It was frustrating, and obviously I know people deal with this day-to-day basis, you know, dealing with the NHS, which can be frustrating. This is my second serious injury. I did have a serious injury probably about 8 years ago, where I had a bad fracture and nerve damage to my right shoulder after a motorbike accident, and that was really good, positive experience with NHS from day one. And yeah, not so much this time. So I won't go too much into it, but cutting long story short, like 10 days later, I ended up getting an ultrasound scan with the NHS. Which did show that I had a rupture. It was a little bit inconclusive, because they weren't sure if, they said there wasn't much of a gap really, but they weren't sure if it was just a partial rupture or if it was a full tear. But because they added it together, like there's clearly a rupture there and disruption of the tendon, and the Thompson test is positive, showing that, you know, there was no movement in the ankle. There's a lot of bleeding, hematoma, process started by that time, so it was clear that there was a rupture there basically. So I was then somehow booked for an appointment to see a GP, see a consultant, like 5 weeks later. They sent me in the post that Saturday, which I don't understand. So at this point, I've never seen a GP, a surgeon, sorry, and they booked me an appointment for 7 weeks. I did in the meantime kind of try and see a private consultant, and who again confirmed that it was a rupture of the tendon, and yeah, so finally, after chasing things up, I got an appointment with an NHS consultant as well, about just over a week after that, after the ultrasound scan. In the meantime, I had further complications where I actually developed DVT in the left leg. Now, DVT, deep vein thrombosis, is a complication that can come with these type of injuries, especially the calf, the Achilles tendon, where there's so much bleeding after the injury, and now you're immobilized, you're non-weight bearing, you're not moving around as such. So there's the propensity there to develop a clot in that tendon, in the calf. So unfortunately, that happened. Again, issues with the NHS. I did go in with the pain, was sent away without even testing for it, because they refused to scan it. When I went to see the consultant, I complained about it, and he did send me for a scan, which showed the clot was there. So they started me on a treatment dose of anticoagulants, blood thinning medication, which I'm going to have to be on now until I'm out of the boot and kind of recovered from this and more mobile again. So that was just frustration. Yeah. So anyway, I saw the consultant. This is now coming to 3 weeks after the injury, where I've just been kind of non-weight bearing, my toe pointing downwards in this time. Discussed the ultrasound scan with him, and basically he said there's not much of a gap, or it's not clear that there's a gap, whether it's partial or full. There's not much of a gap. So he said he would recommend going a non-surgical route. So you can go surgery or non-surgery. So the surgical route is where they kind of go in, they kind of suture the two ends of the tendon together, and it heals. Non-surgical route is they put you in a brace or a boot or a cast and for a period of time, and you just let it heal back. So obviously, looking at the research out there, and there's most of the time, especially when you're young and active, they tend to want to do surgery more than anything, because they say it kind of makes it heal back stronger and gives a quicker recovery time, and there's lower chance of re-rupturing compared to the non-surgical route. The evidence there it varies. Like, it's not clear like how much of a difference, or if the difference is that significant between re-rupture rates of non-surgical and surgery rates. Some put it as low as kind of 3% difference, some put it as high as kind of 20-25% difference. But they both kind of say that as long as you go along with kind of the rehab, the therapy, you strengthen it well, in the end, if you don't get the re-rupture, you end up with kind of similar outcome. Sometimes the non-surgical route can take a bit longer than the surgical route, but you should be able to get back to your normal function and even go back to sports, non-surgical or surgical. So so he said go surgical route, go non-surgical route, and the other consultant I saw privately as well also agreed with that as well. So I thought to myself, but they both said if I really want it, they'll do the surgery, but they just don't recommend it or don't feel the need for it. So I thought about it, and just thought, at the end of the day, I've got two opinions now, both saying go non-surgical route. If I don't need surgery, I'm not gonna push and force for someone to cut into my leg. At the end of the day, there's also the complications of surgery. So things like infections affecting the tendon itself or the skin around it, nerve damage, bleeding, further chance of blood clots, that kind of thing. So I thought to myself, let me just avoid that and just go the non-surgical route. I've seen a lot of good outcomes from that myself in the past from treating it. So let's go down that route. So his protocol, the consultant, was for me to be non-weight bearing for 6 weeks. So I was 3 weeks already. So he said further 3 weeks, and then come back to start weight bearing in the boot. So after about 2 weeks though, I did come back into him, because I thought 6 weeks is a bit long, you know. So he kind of agreed and was like, brought me back in. So probably about a week and a half now ago, I came out of the cast, was put in the boot, started weight bearing in the boot, and they put two thick wedges in the boot to make you so that even though you're weight bearing, you're still in a plantar flexor position with your toes pointing downwards. And so I had to be with the 2 wedges for 2 weeks, then take one wedge off, one wedge for 2 weeks, take that wedge out, and then be just a neutral flat position for the final 2 weeks, and then I'll come back and see him in 6 weeks time and start weight bearing in the boot or normal shoe. So at this point, yeah, I'm about a week and a half into into weight bearing. So 2 more days on Friday coming. I'm gonna take off one wedge and see how things go. So weight bearing's been a bit painful to begin with, a bit uneasy, a bit unsure of myself and walking. So started off obviously partial weight bearing with 2 crutches, down to 1. Now I'm starting, especially around the house, starting to walk with no crutches at all. I've been outdoors. It was a milestone for me yesterday. I was able to walk my daughter to school for the first time in over 6 weeks, which was good. It was slow. A journey that normally takes 5 minutes took about 20 minutes. I was kind of trying to catch up to her. Her telling me to hurry up, and normally it's the other way around. So that was good, but I did it. So 2 more days and I'll take out the other wedge. So here's a picture, just a bit of a video of me just walking with the 1 crutch in the boot. And when I do the next video, once I've taken off the wedge, 1 wedge, you'll see more of me walking as well. So that's me at the moment. That's where I'm at. So obviously not much in terms of what's happening with the Achilles tendon at the moment. I have to wait until I'm kind of can start physio, which will be nearer the time when I'm going to take the boot off and I can start exercising it. But at the moment I'm just in this boot here. You can see it, big and heavy. Have to sleep in it, keep it on 24/7 all the time. Just take it off just to give my foot a bit of a wash. But yeah, so that's where I'm at the moment. So I'm gonna be putting up more of these videos, as I said, over time. I'm gonna be putting up some material on my Instagram, which you find a link to below. Obviously at the moment there's not much there, but I'm gonna start doing this, start pushing on with the videos and just a bit of material. Obviously one of the big things you find about these injuries, especially these long-term ones like this, is the effect psychologically on you. You know, especially me, I'm used to being active, used to being up and about and helping people, helping them recover from these injuries, and now on the other side I'm just here sitting at home a lot of the time, not able to work because obviously I've got an active job. So it gets frustrating, gets really frustrating. You want to push yourself to do things, but at the same time you need to make sure you don't overdo it yourself. But I've been trying to keep active, exercising my upper body, my core, my other leg, my glutes, everything like that, just to keep the strength going there. I've been trying to just keep my mind active, you know, do things like doing this video, doing extra reading, just, you know, you need to getting support from family members and any encouragement, all that kind of thing is important in keeping it positive, because positivity is the key. So long-term injury, you need to stay positive to get through it, and obviously that's going to come in more handy once I start the rehab as well, because obviously with these things, you can tell it's going to be up and down, but the main thing is to avoid pushing it too far and then running the risk of re-rupturing and then being back to square one again, which clearly I don't want to do. Yeah, so keep in touch. Stay tuned for the next videos, and comment below your experience or any questions you got about my treatment or my plans, or if you've got other protocols that you've gone through or seen or treated people with. That would be interesting as well. So yeah, stay tuned, and thanks.